The Wichita Falls, Wichita County Public Health District reports the first confirmed case of COVID-19 in Wichita County. The patient is a 64-year-old Wichita County resident who traveled to Budapest in Hungary. He flew into the DFW airport and returned to Wichita Falls via car. Upon return, he developed a cough and a sore throat. He was seen by a private physician and was tested by a private laboratory. The patient is currently being cared for at home, and their movement has been restricted to their care setting only. Upon the patient's return to Wichita Falls, public health guidelines were followed so that the patient and spouse were isolated to their home other than the medical visit. The only other person the patient has had contact with is their spouse, and the spouse is also self-isolated, and the spouse remains asymptomatic. There are no other members in the household. The health district emphasizes that everyone can take the necessary measures to protect themselves and prevent the spread of COVID-19 or any other respiratory illnesses by doing the following: practice social distancing, washing your hands often with soap and water, or using a hand sanitizer if water is not available. Cover your sneezes and coughs. Keep your hands away from your face. Avoid people who are ill. Preventing the spread of any respiratory illness by staying home if you're sick, and routinely cleaning commonly touched surfaces. The COVID-19 situation continues to change daily. The health district will continue to monitor for and respond to any COVID-19 cases in Wichita Falls and Wichita County. We will keep our citizens informed as the situation evolves. A phone bank will be activated today by 11 a.m. at the health districts for citizens who have questions. The helpline number is 940-761-7909. And with that, we'll open up to questions.
64-year-old male?
A 64-year-old resident. We're not giving the sex of the individual in order to protect the privacy of that individual.
Our first case, will we go into the more closing of gatherings of over 10 to 50 people?
Mary, you want to answer that?
Repeat that whole thing, please.
I also want to introduce Colonel Bell's here with us from Shepherd Air Force Base. He wanted to stand in solidarity with us, but make sure if we had any questions regarding the base, he's here also for that. Right now we're going to, after this, we're probably going to start discussing what we're going to do next. We want to make sure that we had all staff and council informed of this case first, and of course let the public know before we start those discussions. But we got Woody Gossip here from the county. Chief Perlman's also here. So we want to do that first. We're going to sit down on a round table and try to get that discussed and see what kind of process we want to do next before we just do a knee-jerk reaction, start shutting places down. We want to make sure that we're systematic in what we're doing. But the most important thing right now is to get the information out to the public so people can be socially responsible. Now, we said we had a set of protocols before our first case, and we'll have a set of protocol after. We're still sticking to that, but I'm hoping the citizens do the same, that they're going to start limiting themselves to some of the things, some of the things they need to be doing out there, some of the groups or sessions that they might have out there. We're starting to see a lot of cancellations, a lot of businesses, being socially responsible right now. So right now, at this time, I think we'll get back, we'll talk to Lou. Of course, we lean heavily on our health department for those answers. We're going to start looking at what CDC is doing, what other likewise cities are doing. We did a lot of research last night in regards to what's Abilene or a Tyler, or people that haven't had their first case, and what are people having their first case, what they're looking like. I think every community is unique. We're going to take a really good inside-out look at our community and see what we're going to do first. But first, we're going to have some meetings, and then we'll get back to the press and make sure that our PI office, Lindsay Barker, gets that information back out to everybody. But we're going to be recommending. So.
You can ask more questions.
Sure.
Please. So when do you know when that roundtable will happen? Is there a schedule to begin that, or?
I think that's going to happen immediately. We're going to leave this press conference, get back. We've got meetings all day. I know we want to have a 1 o'clock press conference. I would say press conference, sorry. 1 o'clock meeting with Shepherd, the county health department, and some other parties. So we'll make sure they're all on the same page. As soon as we break from that, we kind of have a solid feel of where we're going to be going. We'll immediately get a press release out so the public can know. are going to be depending heavily on social media and to the actual media to get this information out there for us.
Lou, this might be a question for you. Do you know when exactly that person or patient came back to the United States and where they've been in Wichita County since then?
They came back on the 10th. They haven't been anywhere in Wichita County. They drove in from DFW, went immediately home that evening, and began feeling symptomatic and called their doctor to let them know they were coming in, and then were seen at the physician and went immediately home. So they have not been anywhere in our community, and I think that's important for our community to remember. This truly is a travel-related case, and there is no risk to the community from this traveler.
Should the community be doing anything differently? I mean, I know you kind of just said that, you know, what you just touched on, but I mean, now that we do have a confirmed case here, is there any measures that the community needs to be taking additionally now?
I think they need to be taking the same precautions that they were taking before, those that I went over. The most important thing that people can do to protect our community is if they're sick, to stay home. If they're having any symptoms of COVID-19 or really of any illness, they need to stay home and take care of themselves. If they feel like they need to see a physician, they need to call their physician first, especially if they think they may have been exposed or may have COVID-19, so that that physician's office can prepare for their visit. So I think those are the things that are important to remember. Again, as I said at council yesterday, we want individuals to be prepared but not to panic. This certainly is a changing situation for our community, and we want them to take that seriously, but again, we don't want them to panic.
So can you comment or confirm if this has any connection whatsoever in any way to the base at all?
It has no connection to the base whatsoever.
Does the private doctor's office, did they take precautions, anyone being tested in that office?
They did. They were aware of the situation, and they followed all precautions in seeing this patient.
Do they let any of their patients know, or did they have to shut down?
That would be, they won't have to shut down, and that will be, those are decisions that would be made by that physician's office.
Anybody else?
Do we know what the school district's gonna do now? So,
We do not, and again, this is a rapidly evolving event. We received the notification this morning when we came into work, and it's now 9:30. So we've worked really hard to let our community partners know, and we wanted to make sure, because we've said all along that if we had a case that we would immediately let the public know, and that was our top priority this morning. And so we will be meeting to make other decisions, but we really wanted to make sure that the public was aware of what was going on first. So as the mayor said, we will be working on all of the other decisions that we as a community need to make.
Do we know if this patient has any of the underlying conditions that have been talked about?
Due to the protecting the privacy of the patient, we're not going to release any patient information.
Is there any way we could also get a copy of your statement? You're going to be sending it out to the media?
Yes, we'll be sending a press release out to the media.
Anybody?
Everybody wish to speak on
I think everything's okay.
Thank you.
Anybody else? All right, well, thank y'all for attending. What we'll do right now is we're gonna kind of reconvene at another location, do some talking, maybe get our phone calls out to ISD, MSU, some of the big pillars of our community, and kind of go from there.
Thank you so much for being here.